Hello all, we are back to Radio Express and today we are going to have a recap of paranasal CT scan sinus. We are going to have a look at the normal and couple of abnormal structures. So this is a CT scan sinus coronal section. The first thing that you see as marked by the yellow arrow is the frontal sinus. The frontal sinus is quite small in this case. You start noticing the septum and orbits. As we move further, I would like to show you the structures. Can you identify what are the structures? These are lacrimal sac. As they traverse further, they open in the inferior meatus. Can you see that? Next, adjacent to the inferior turbinate, it's opening up. I have encircled with yellow. That's the arrow, we can see. Can you identify the structure? This is where the inferior orbital nerve moves and it traverses. It starts from the floor of the orbit and moves anteriorly. The other thing that you have noticed is by now there is opacification of the right maxillary sinus, also a bit of right anterior ethmoids as compared to the left. So this unilateral sinusitis can be because of number of pathology. In adults, it can be because of fungus or oroantral fistula or a benign tumor. As seen, the normal sinus appears black because black is air on CT scan. The right maxillary sinus, which is marked in yellow, is opacified. Can you identify this lesion? I shouldn't say a lesion. Can you identify this anatomical landmark? This anatomical landmark over here, and as you see, it's moving further, coming across medially. This is anterior ethmoidal artery. The yellow arrow points out to the medial rectus. The reason why I'm showing the medial rectus is to identify the anterior ethmoidal artery. The anterior ethmoidal artery is between medial rectus and superior oblique. That's where it emerges out. So whenever we are doing any surgery to frontal sinus or going all the way to skull base, we need to know if this vessel is coming in the parenchyma. As we move further, by now you would have seen and noticed that the lesion in the right maxillary sinus is bulging out of the maxillary ostium. It has widened the maxillary ostium. So what can be the cause of this? What I noticed over here is, if you can see the arrow, that's the root of the teeth and there is a breach in the floor of the maxillary sinus. So in case this patient had periapical cyst or dental cyst, the cyst can rupture and cause infection of the maxillary sinus. In this section, you can clearly see that. Further, moving forwards, the posterior ethmoids appear to be normal, and as we move further, the sphenoid sinus, which is seen here, is normal aerated as well. Before finishing the scan, I would like to show you two important structures. The structure over here, that's the Vidian canal, and the structure over here is the foramen lacerum. So on the floor is the Vidian canal, and inferior laterally is the foramen lacerum. Thank you.